Good morning, everybody. Today we are going to start our first topic of exercise therapy. The topic's name is goniometry. So, why do you think we want to learn this topic or we need to learn this topic? Is because before giving any treatment to a patient for their ailment or for their impairment, you need to first assess the condition, that why there is so and so impairment, why there is reduced movement at a particular joint, why a patient is unable to move the joint, why is there pain in the joint. So before giving any type of treatment, you need to first assess the patient. So goniometry is a type of assessment technique. It's a diagnostic procedure. So before you think about any exercise or any modality, which you'll be reading later, much later, that you want to give to a patient, you should first find out the reason behind the issue, the reason behind the dysfunction, the movement dysfunction, what the patient is having. So in that context, you need to have an instrument which helps in measuring the movement, which gives you a result in degrees. That instrument is known as goniometer, and the method through which you assess the range of motion or the movement at a particular joint is known as goniometry. Now you go back to your basics. You remember, you know that, for example, there is movement known as shoulder abduction. So when you are doing shoulder abduction movement, the normal range of motion or the normal degrees what is available at a joint is 180 degrees. So how do we come to know it is 180 degrees? How did we assess that there is 180 degrees of movement available at the shoulder joint? That is because we have instrument which is known as goniometer. We use that instrument and then we measure how much amount of movement is available at a particular joint. So with that context, goniometry or goniometer is being derived from a combination of two words, which is known as gonia, which means angle, and metron, which means measure. So measuring the angle which is taking place at a particular joint is known as goniometry, and the instrument used to measure this range of motion, measure this movement, is known as goniometer. So coming to the definition, it refers to the measurement of angle, in particular the measurement of angles created at the human joints by the bones of the body. This technique helps in determining a particular joint position, and it will tell you about the total amount of motion available at the joint. So in a normal person, you have range of motion for shoulder abduction 180 degrees, shoulder flexion 180 degrees. If in the patient population you want to check, it might change, it might reduce. Okay, so that is why this technique is very important to find out what is the cause or how much is the movement reduced in a particular condition or a patient. That is why goniometry is very important when you're dealing with patients. Now coming to the basic concepts. So in first year biomechanics, these terminologies were already taught to you. I will just go through it so that you remember these terminologies which we will be keep on using. So the first terminology is kinematics. Kinematics is the study of motion, study of movement without considering the forces that are creating the motion. Simple terms, it will just tell us about that how or how a joint is moving, which joint is moving, okay, in which direction it is moving. It will not tell you about the forces that are creating. That means we're not going to talk about which muscles are creating that particular movement. We are talking only about the bony structure. Okay, that is known as kinematics. Alright. So kinematics describes the motion of bony segments with respect to type of motion. So the motion can be translatory, it can be angular, it can be combination of the two. In which direction the movement is happening, whether it is abduction, flexion, it is in frontal plane, it is in sagittal plane. So which direction or which plane the movement is happening also comes under the study of kinematics. Then location and at what rate of change or velocity the segment is moving. Okay, so this is kinematics. So again, I'll repeat, kinematics is a study of motion or movement without talking about the forces which are causing it. That means we're not talking about what muscles are causing this movement. We're talking only about the bony structures which is causing a movement. Next, under kinematics, we have two subheadings or two subdivisions which is known as arthrokinematics and osteokinematics. Okay, so what is arthrokinematics? Arthrokinematics is nothing else but what movement is happening within the joint surface. The movement happening within the articular surfaces of a joint is known as arthrokinematics. These are those movements which you cannot see when a patient is doing any movement. Okay, you cannot visualize these movements. These are happening within the joint, so you can't see them. Those movements are like sliding, gliding, spinning, and rolling. These are the movements happening within a joint surface which you cannot see with your eyes. Okay, that is known as arthrokinematics. But it is very, very important to complete any movement. If arthrokinematics, if there is issue in the arthrokinematics of a joint, then there will be a restricted movement of a particular joint. If the joint is unable to slide properly, unable to roll properly, then please be sure that definitely the movement of that particular joint will be impaired or restricted. Alright, even though if you cannot see arthrokinematics happening, it is very important for a complete movement and a smooth movement happening at your joint. So after talking about arthrokinematics, we'll talk about osteokinematics. Osteokinematics are those large movements, those gross movements which you can visualize while you are doing, while your friend is doing, while your patient is doing. Whenever somebody does a movement and you can see those movements are actually known as osteokinematics. Those are those large bony segments which are moving, that is known as osteokinematics. So suppose if I am doing shoulder abduction, shoulder flexion, you can see my shoulder moving in a particular direction. You can see that bony segments are moving. You can understand those movements. That is known as osteokinematics. So when we say what are those movements which comes into osteokinematics, it is nothing else what actually you can see. The physiological movements happening at a particular joint is known as osteokinematics. So example like flexion, abduction, adduction, internal rotation, external rotation. So these gross large movements is known as osteokinematics. Arthrokinematics, don't get confused, are those small movements which is happening within the joint surface which you cannot see while patient is doing any movement. And arthrokinematics, osteokinematics should happen together. They happen together to produce a complete and smooth movement of a particular joint. If you want a smooth and complete movement of shoulder abduction, your arthrokinematics and osteokinematics should go on together to get a complete and smooth range of motion. So both arthro and osteokinematics are very important, and if there is issue in any of the kinematics, whether arthro or osteo, there will be reduced movement at a particular joint. So goniometry helps in measuring these movements, helps in measuring the movements happening due to osteokinematics, your physiological movements. It will not measure rolling or sliding or gliding. It will measure the physiological movements, which is your flexion, extension, abduction, adduction, rotations. So those gross big movements can be measured and recorded by goniometry. So now I hope you have understood what is goniometry, what is goniometer, the basic definitions of the two, the basic concepts of kinematics, arthrokinematics, osteokinematics. I hope you are now a little bit clearer. So coming to the another basic concept of position. The first figure you see, which is written as anatomical position. What is anatomical position? Anatomical position is when, if you are standing, your anterior portion of your palm should face forwards. The fairer portion of your palm should face forwards. That is known as anterior position of the body. Okay, anatomical position of the body. When your anterior portion of the palm is facing forwards, that is known as anatomical position. What is neutral position? When the thumb is facing forwards, okay, when you have kept your arms hanging by your side and the thumb is facing forward, that position is known as the neutral position. So just be aware, these are the two type of position which we'll be talking very frequently in the upcoming slides and classes. Okay, now coming to the newest definition which you will now, which is very important to learn goniometer and goniometry, is the range of motion. What is range of motion? It is the arc of motion in degrees. Please understand, it is the arc of motion in degrees between the beginning and the end of the motion in a specific plane. So when I say that shoulder abduction is 180 degrees, so you know how to do shoulder abduction. Your palm is hanging uh, next to your trunk, okay. From that position you start and you take your arm away from your body. Alright, you take your palm away from your body in the frontal plane. So starting from 0 degrees, when your arm is hanging close to your body, going up and above your overhead, that is completely 180 degrees, and that is the arc of motion which your shoulder is making, which your joint is doing in a specific plane. So I said shoulder abduction happens in your frontal plane. Shoulder flexion happens in your sagittal plane. So axis and planes was already taught in your first year. So you just brush those that knowledge and then you'll understand it better. So that arc of motion happening at a particular range, and when you measure it in degrees, is known as range of motion. So when I say what is the range of motion at shoulder abduction, it is 0 to 180 degrees. Okay. So it is the amount of motion that is available at a joint or arc of motion through which a joint passes. Okay. The starting position for measuring all the range of motion is either anatomical or neutral position. In the previous slide, we understood what is anatomical position and what is the neutral position. So all the range of motion what we are going to learn in later classes using goniometer will be done either in anatomical position or in neutral position. So therefore you remember what is anatomical and neutral position. And I hope you understood what is range of motion. It is the arc of motion in degrees which is happening between the beginning and the end of the motion in a specific plane. So already I have given you example for shoulder abduction 0 to 180 degrees. You start from 0 degree angle of the shoulder and then you end at 180 degrees of angle for shoulder abduction. Similarly for shoulder flexion, you start from 0 degree neutral shoulder range of motion, and then you take your arm up in the anterior direction in the sagittal plane up and above, so that the arc is completed at 180 degrees. Okay, I hope it is clear. So there are three notation systems which is used to um, document any range of motion. The first one is 0 to 180 degrees. I gave you a simple example that you are sitting or standing and your arm is in neutral position. From there, when you start and you take it up and above, you complete the full range of motion towards the arm coming towards your head. That is 0 to 180 degrees system. Now from that position, from that 180 degree where your arm is right now, at that position when you take it down towards your body, that is 180 to 0 degree system. 360 degree system is when you are rotating your shoulder in all the directions. Okay, that make a full circle. When you cover it completely, it is known as 360 degree system. Okay, so you can see this figure for the first two systems. This is when your arm is at the side of your body, that is known as 0 degree starting position, and then you take it up superior aspect towards the ceiling. That means you're taking from 0 to 180 degrees. Alright, now from that 180 degree, now where your arm is, the last position of your arm was 180 degrees. So from there, when you take it down, it is 0 degrees. Okay, so 0 to 180 degrees is one system, and 180 to 0 degree is second system. Now in the same figure, when you see that the arm is taken behind from neutral, from 0 degrees of shoulder movement, when it is being taken behind, that movement is known as extension. Okay, so 0 degree till extension, which is 40 to 60 degrees of extension which takes place at your shoulder. Alright, so these are the degree of systems. In these systems only we have to report our range of motion for every joint. Okay, now coming to another basic definitions. The first one is active range of motion. Active, what do you mean by active term? Active means voluntary. Active means when you do it by yourself. Active means when there is no assistance from anybody. It is you who are doing any particular movement or any activity with voluntary efforts is known as active. The term is known as active. What is active range of motion? We know that range of motion is the arc of motion which is taking place at a particular joint in a particular plane and measured in degrees. When you do that actively, when you're doing that voluntarily, that is known as active range of motion. So with the help of goniometry, with the help of goniometer, we are going to measure this active range of motion. Okay, so amount of motion attained by a subject during unassisted voluntary joint motion. That means the patient or a person is doing the entire motion, the entire movement by himself. There is no external support given by the therapist or given by any other instrument. So if you see the figure, here the therapist is saying, try to touch my finger. Therapist is not assisting the movement of the patient, right? So you can see in this figure the patient is trying to do hip flexion. This is supine position and the patient is trying to do hip flexion without any external support. So when you do that, that is known as active motion. And now when you measure this motion with the help of goniometer and document in degrees, that is known as active range of motion. Okay, I hope this is clear. So what are the uses? Why do we need to make patient do active range of motion? Because if I tell you kindly do shoulder abduction, and if you are able to do that motion, that means you are willing, you can do, you have no issues in completing that movement. Pain is not stopping the movement, any you don't have any other difficulty. So when you're doing active range of motion, it will tell us about whether the subject is willing to do or not willing to do. It will also tell us about the coordination, how smooth the movement is going on, whether there is purely shoulder abduction happening or whether there is combined movement which is going on. So it will also tell us about the coordination of movement which is happening. Thirdly, it will also tell us, or it will also help us in understanding whether the patient has enough strength in muscle to complete that range of motion. Okay? If the muscles are weak, definitely the patient cannot complete the movement. So it will also tell you that patient has strong muscles, or it will give you some idea whether patient has strong muscles or weak muscles in order to complete that movement. And lastly, definitely when you're using goniometer, then it will tell you about the degrees of range of motion or the amount of range of motion available at a particular joint. So that is why it is very important to do an active range of motion when the patient comes to you. Patient comes to you with shoulder pain. You first need to, whichever movement is paining, or you have to make sure that patient does that movement in front of you. That will tell us about whether the patient wants to do that movement or not. If it's too painful, patient might not be willing to do that movement. So you will come to know that okay, maybe it is very painful, that is why patient is unable to finish that movement or unable to do that movement at all, because there can be pain, right? And if the patient is doing, and instead of shoulder abduction, patient is patient is not doing clearly in frontal plane. He is not doing a clear cut smooth plane or smooth movement. It will tell us about the coordination. Muscle strength, as I mentioned before also, if there is weakness of muscle, you can probably see that patient, the movement or the the quality of the movement is shaky. It may shake because the muscles are weak. It is not smooth enough to complete range of motion, or maybe the patient cannot complete at all. That can give us hint that there can be muscle strength issues. And lastly, when you're doing with a goniometer, when you're measuring that range of motion, it will tell us about whether that much range of motion is available at the joint or not. If there is reduced range of motion, we can understand that there is some issues with the joint itself. That is why active range of motion is very, very important when you dealing with your patient. So let's see. These are the I'll just talk about shoulder, because this is easier for you to understand in a class happening on PPTs. So you see the shoulder abduction. Patient is standing. Patient can either sit or stand in anatomical position or a neutral position. When you ask the patient to take the limb up in the frontal plane, that means sideways, not frontways, sideways. When you ask the patient to take the shoulder up and above till your head level, that is known as shoulder abduction. The complete range of motion of shoulder is 0 to 180 degrees. Okay, so the first figure is telling you about shoulder abduction. Now the second figure, we have seen shoulder abduction. When you take it back, it's coming till the neutral, and then you cross it towards the body, cross it towards the center of your body, that is known as adduction. So that means from 0 degrees till crossing the midline of the body, that is known as shoulder adduction. Okay, I hope this is clear. Next is flexion. So flexion, the range of motion is similar to shoulder abduction, which is 0 to 180 degrees. The only difference is the plane in which the movement is happening. So the plane where flexion happens is sagittal plane. So again the arm is at the side of your body and you take it anteriorly, front ways and till the head level. That movement is known as flexion. So again, when you're recording this, if it is complete range of motion, it is 0 to 180 degrees of flexion available at a normal joint. Now coming to extension. So you see the figure carefully. And you can see that 0 degrees, that is neutral position of the shoulder. When you start from that position and you take it anteriorly and till the level of head, above head, that is 0 to 180 degrees, that is flexion. And then you come back to 0 degrees again. Now from 0 degrees and taking the shoulder, taking the arm backwards is extension. Extension is not coming back from top to 0 degrees. That is range of motion for flexion. Starting from 0 and going backwards in the back direction is known as extension, and the range of motion for that is 0 to 60 degrees. Okay, so don't get confused between flexion and extension. When you take it up and above the head level, that is flexion, and when you start from the sideways and take it behind, that is extension. Now coming to rotations, you know that there are two rotations available at shoulder joint, which is internal rotation and external rotation. So when you are seeing this first image, the shoulder is at 0 degrees. Okay, the shoulder is in neutral position, that means 0 degrees. And when you take the arm towards your stomach, towards your tummy, the first figure A, that is internal rotation at 0 degree shoulder. Please remember, don't get confused. This is internal rotation at 0 degree shoulder. When you see the figure 2, it is again shoulder is at 0 degree, that means neutral position of shoulder. And when you take the arm outside, that is known as external rotation. When you take it away from the tummy and out away from the body, that is known as external rotation at 0 degree shoulder neutral position. The third image is when the shoulder is at 90 degree of abduction. At 90 degree of abduction, maximum rotation happens at the 90 degree of shoulder abduction. Okay, so when the shoulder is at 90 degree and you take the arm inside, that is internal rotation, and when you take it up and outwards, that is external rotation. So I will repeat again everything so that you don't get confused. The first figure is shoulder internal rotation at 0 degree position of shoulder, which is the neutral position of shoulder. So when you take the arm towards the tummy, that is internal rotation. When you take it away from the tummy outwards, that is external rotation. Shoulder is at 0 degree neutral position. The third position is shoulder is at 90 degree abduction. 90 degree abduction is the position where maximum rotation of the shoulder happens. So you can see in the figure only that so much the person is able to rotate internally and externally. So at 90 degree of shoulder, when you take the arm inside, inwards, it is internal. When you take it upwards and away from the body, it is external rotation. Coming to passive range of motion, I hope the active range of motion is clear. Active, always remember, it is done voluntarily by the patient. There is no assistance given by the therapist. And when you measure that range of motion, when you measure the movement in degrees using goniometer, that is known as active range of motion. Now coming to passive range of motion. Passive range of motion is the movement or is the motion which is actually done by assistance, which is done by the therapist. Patient is not doing anything. When you lift up the arm of the patient and you take it up into abduction, that is known as passive shoulder abduction. Okay, where that means it is not done by the patient, it is done by the therapist. You can see the figure, the patient is lying down and the entire movement is done by the therapist. Now when you measure this range of motion simultaneously, when the therapist is taking into abduction or adduction or whichever movement and simultaneously measuring the range of motion, that is known as passive range of motion. So normally passive range of motion is slightly more than the active range of motion, because active range of motion can reduce if there is muscle tightness, if there is joint issues, if there is pain, if there is weakness of the strength. So active range of motion can be lesser than the passive. When you're doing passive range of motion, the all these factors will not come into picture. So normally the passive range of motion can be more than the active range of motion, because you are also stretching certain structures so that you complete the range of motion. Okay. So what are the uses of passive range of motion? Passive range of motion will provide the information about the integrity of the articular surface. Articular surfaces means the joint surfaces, whether there is any abnormality, whether there is any issue within the joint surfaces, whether there is tightness of the capsule, ligaments or the muscle. If your structures are tight, your active range of motion automatically reduces. So when you're doing passive range of motion, you can find out, you can ascertain that so and so structure can be at fault. That is why the range of motion is less. So passive range of motion will actually tell us about any issues in a patient's muscle, joint or ligaments or capsule, because of which there was reduced active range of motion. I hope I'm not confusing you. So whenever you are doing active range of motion first, that is the first thing you will do. If the active range of motion is reduced, then you will do passive range of motion to find out the reason why there is reduced active range of motion. Okay, so in cases of impairment such as muscle weakness, passive range of motion and active range of motion will be different. If there is muscle weakness, your active range of motion will be less. But when you're doing passive range of motion, the range of motion will increase, because therapist is doing the movement. Therapist is pushing the joint in a particular movement. So muscle strength, even if it is poor, it will not cause any reduced range of motion. Okay, so these are the important concepts. If you have any doubts, you can clarify with me later. So these are the concepts which you must understand. Why active is important, why passive is important. Active will tell us about the willingness of the patient. It will tell you about the muscle strength. It will tell you about the range of motion. While passive will tell you about which structure could be at fault. Which structure could be at fault which is causing reduced range of motion. Okay. So with this, we come to an end to our first module of goniometry. I hope the session is clear, but if you have any type of doubts, you are free to ask me. You can put as comments, you can ask your doubts in the comment section, and I will definitely help you. In the next segments, we will talk about more in detail about principles and procedures of goniometry. Thank you so much.